like the fact that I get to use my skills that I learned in school. So we take anatomy, we take physiology, we take kinesiology, kind of knowing how the body moves. And somebody may come to me and, oh, I was raking over the weekend, and you know what, I suddenly started feeling shoulder pain, and now it won't go away, now I can't lift my arm. I like to use my mind to kind of figure out, okay, what's going on here. That's my challenge. I had a back patient the other day, and I can't figure out how to get him moving, and just may have a back injury is that bad, but I still like that challenge, that variety of it. Whereas sometimes when you work in a hospital setting, I didn't find it as, it was rewarding that I took it as a challenge to go in and cheer that patient up, get them moving, maybe lift their spirits. But from a technical standpoint, it's not as precise. It doesn't have to be as precise. We're just trying to get them from getting out of bed to getting moving. Whereas outpatient orthopedics for me, it's I want to solve their problem. I want to figure out how to get them back as an athlete, as an employee, whatever it may be. So that's what I really find I like about it. It's a lot more competitive to get into outpatient clinics, or used to be. And I'll talk about that in a bit, but now there's lots of openings locally for sure in outpatient orthopedics. Sports teams. So, you know, that's everybody's dream that usually goes into this. A lot of people that go into physical therapy had it at one time, had a sports injury, had an experience with an athletic trainer or a physical therapist that just kind of hooked them onto the field. I did athletic training at Marquette, worked with the basketball team, got to do all that. I didn't get my athletic training degree, but it kind of actually turned me off, believe it or not, from doing sports teams. One of the things is I saw how hard they have to work. So you think of these professional athletes, right? They're paid millions of dollars. They don't want to go a day without the rehab. The coach, the owner, doesn't want to go a day without them getting some sort of treatment. So it's very demanding. I saw the head trainer at Marquette. He would go on a road trip and be gone from his family for 3 days, and then come in the next day at 7 o'clock in the morning and be there till 10 o'clock at night. But it is also rewarding to be around. It's exciting. You get to, you know, see athletes up close, work with them up close, see them return to the field. So it's kind of a cool thing. A lot of times you do need to know somebody. That's just the way it works. You know, it's sometimes our therapists can do a clinical rotation. They do it through Milwaukee Brewers does one, for example, in spring training. And so that's sometimes a way to get your foot in the door. Like I said, not necessarily family friendly. It can be 24/7. It can be somebody hurt themselves on practice and didn't tell you, and the next day you got to be in your own. Typically, most of these therapists aren't just dedicated to one team. So the Packers, the Brewers, the Bucks, they all have their therapists, but they work in another clinic as well. So it's not like it's gravy by any means.
So like Kim, who works with us,
Mm-hmm.
so she's here at about 2:30, but the rest of the day she's in the clinic?
She doesn't work with patients, so she's an
Okay.
athletic trainer.
Okay.
And just to kind of touch on that, I was going to anyway, so it's perfect time. So athletic trainers are a little different. They can see patients. They have similar skill set to therapists, not quite exactly the same, but there's not the adoption of insurances to cover that as much. So athletic trainers, in her case, she helps me with durable medical equipment. So she helps us with knee braces and slings and things like that. So that's her other amount of time. Athletic trainers, it's not as easy as a job, a workforce to get into. Athletic trainers also tend to be more, they're going more towards the workplace environments, kind of being on site.
Sure.
But so, physical therapists, the physical therapy job market, so it's projected to grow 20% in the next decade. The average job growth across all health jobs is about 8%. Currently, nearly every therapy business in the Wausau area is recruiting for PTs. So we've been looking to hire PTs ever since I started, to be honest with you, but we've really been looking hard the past 6 to 9 months. We hired one, we need another. Hire that one, we need another. But other area businesses are hiring too. It's always a little harder to attract candidates. It's not, I don't think, because of our organization. I think it's geography a little bit plays a role. A lot of people graduating from college want to be near the big city. So that's one of the things we've always had difficulty in this area. I've been here for about 20 years. Nursing homes are hiring, hospitals hiring. outside of the Waus area, they're hiring as well. So it's a very solid job market in central Wisconsin. As a whole, there's contract jobs that are out there that therapists can take too. Actually, one of my therapists just was talking to me about that, where you can get a 13-week contract and go work in Arizona, go work in California, and then you can get another one to go work in Texas. And so there's lots of job opportunities. Usually those contract places pay a little bit more, so that makes it attractive. If you don't have a family, you don't have ties, a great thing to do. Median pay is approximately $88,000. Varies a lot by where you're located, what your clinic type is, what's the reimbursement. A new grad's gonna make around $70,000. So it doesn't sound too bad, right, coming out of college? Pretty attractive. But one of the things, going back to that education portion, is you're taking 6 years of school, and that's gonna be our challenge more and more as we go forward. If college costs keep continuing to rise, insurance reimbursement keeps going down, where does our pay fall? I'll tell you, to be honest, I came out of Marquette with $70,000 in student loans. Which, today's terms, that's small. I just remember starting at $40,000 a year, and my student loan payment on the 10-year plan was $1,000 a month. On the 20-year plan, it was $455 a month. So that's a car payment, that's a house payment. I mean, by no means am I discouraging anyone for financial reasons to go, but it's something that I have concerns about our profession. A lot of times you can get scholarships for the undergrad portion, so the first 4 years. It's usually years 5 and 6, that's where I racked up all my student loans. But it's one of those things, you will have a job, you have a degree in PT. I don't see this field going away. And insurance companies, employers are looking more to therapists as preventative to help reduce their costs. And that's really what we believe our role is in healthcare.
And that's why those contract jobs look pretty appealing.
Yeah, exactly.
And
Yeah,
it's the same thing with nursing, I mean, they do those traveling nurses.
yeah, exactly.
Tons of money.
Yeah, you can go and get these traveling jobs and they pay you a stipend.
Yep.
You don't have housing costs, and it does, you don't have a house, you don't have to worry about rent. Go
Right?
stay at mom and dad's when you're in between jobs, and all your money can go to the student loans. We're also seeing in some of these areas where it's hard to track is they'll actually pay for some of your college education. So a lot of them are giving $10,000 a year for each year you give us of service. We'll pay you $10,000 towards your student loan. So they're trying to make it more attractive. Okay, so I always believe in being honest in these things, and you guys can ask me any question you want about this. What I like about being my PT, every day is different. Like I said before, no two people with the same diagnosis respond the same way. There's always something new to learn. I always tell my students that come in that are in PT schools, if you think you know everything in this field, you're lost, because it changes tomorrow. There's a new study that comes out and shows this technique works better, this technique. When I started in school, everybody got an ultrasound. Anyone here have an ultrasound done before, therapeutic one? So that used to be almost every patient that walked through the door. Now I'd say it's more rare that we do that. We use our hands a lot more, we use other techniques, just because the research isn't quite there. I still use it on occasion, but it has to be the right patient. But it's something that it's continually evolving. I take continuing education every year. We have to do, every licensure period is 2 years. I have to do 30 hours of continuing education during that time. So whether I choose a shoulder or a knee or a back and try and learn new techniques. I get to work with people closely and get to know people. Sometimes I think, oh, I should have gone on and maybe, I don't know if I was smart enough to be a doctor, but gone on and been a physician or something like that. But the one thing I really like is I get to sit with my people, talk with them, sit with the patients, and it's 45 minutes. We've all been to the doctor where they're in and out in 5 minutes, right? And to me, it's kind of nice to get to know people. I like to talk to people about whatever it may be, the Packers, the weather. Yeah, it's small talk sometimes, but it's something it's kind of a nice thing to do throughout the day. Usually PT clinics are pretty casual, so our staff is, we usually all get along well. It's a very open environment, so get to know your coworkers well and other patients well. I'm always busy, it's fast paced. My therapists are scheduled every 45 minutes with the patient, so we usually see you for about 40 minutes or so, and then it's finish a note, go on to the next one. And this one's a knee, the next one's a back, the next one's a hip, the next one's a shoulder. So it's never this monotonous kind of thing where I'm doing the same exercises all day long. On a daily basis, I'm challenged on a personal and professional basis. So, in my role as a director, I'm managing people, so that always makes it challenging. But you know, because you get to know people, because you get to see what they're going through, it definitely hits you personally. Sometimes you see different things, and you know, makes you appreciative of what you have. Professionally, I think like I said before, there's always something to learn. Much more to treating than just the physical person. So my wife, as I told you, is a physical therapist too. I always joke with her, I treat the mind and the body. But we're seeing that more and more with patients, that somebody comes in and they've had this injury for 3 years, and there's a lot more psychological aspects to it. That's kind of another new area that we're going into as therapists, where somebody sees their injured hand as not being a part of their body. That's things we have to deal with. So there's lots of factors with treating patients. Again, it's that challenge that I like, that, you know what, this patient just doesn't seem to get better. Why is that? Well, you find out there might be problems at home or problems at school or something that's kind of in the background. So I like that aspect of it. Again, it keeps me challenged. I'm not the type that I want to sit behind a desk and not talk to people all day. Challenges to our profession. Decreasing reimbursement, as I mentioned before, so insurance companies, businesses, anyone that pays for insurance is trying to find ways to decrease the cost of services. In Wisconsin, in this area, all of my therapists see one patient at a time, the whole time. I have a former coworker that went out to Arizona, he sees 25 patients in a day. So twice as many patients. So he sees a patient for 15 minutes, and he passes that person on to a non-trained, somebody who's just trained on the job. Somebody, anyone in this room could do it. It'd be a PT tech, where you get trained on the job to go through with that patient all their exercises. I think that diminishes our clout as a therapist. So that's one of my concerns with the decreased reimbursement. The other thing is chronic shortage of PTs across the nation. It's growing so quickly, so fast. They can't keep up with therapists. That my fear is they're going to turn to other people to take our jobs. So in other words, all right, if therapist isn't available in the hospital, we're going to have the medical assistant, the nurse, take that patient for a walk. And that person may not be as well trained with how to teach them with a safe gait or to pick up on some of those things, and where our job as a therapist will be devalued. I think it's a long ways away from that, but just some of the concerns I have. I didn't go into this, my wife and I have this talk all the time, like we didn't go into this to see 25 people a day and see them for 15 minutes. Any questions so far? Almost done. Therapists, one of the big things they have, having a full schedule like this. This is one of the things I always struggle with, is having a full schedule of patients. It's not easy to say, wow, it's April and it's 70 degrees out and I want to go golfing. So usually our therapists are always full. Like I said, we've been short some therapists. Our therapists are usually booked out 3 to 4 weeks. So it's not so easy to just suddenly cancel your day. I think the other thing is therapists, we have this fear of failure. We're, in some cases, in the non-surgical cases, we're like the last step before a patient gets something more invasive. So my back patient that I'm not getting better, that happens to be a personal friend as well, his next step is going to be an injection. So where they do an injection to his spine. If that doesn't work, then he's on to back surgery. So I think that's always our challenge. We do take that seriously, getting people better. And then again, I already mentioned that decreasing reimbursement and devaluing their services. All right, any questions on anything?
I do.
Yeah.
So as the director,
Mm-hmm.
is that something that get paid in addition to, like, so you still see patients as a therapist? So then as the director, what more do you have to do on the job? Do you schedule? What do you do with that?
So at my role where I'm at now, I treat probably 30% of the time.
Okay.
And I usually will see the overflow, so if somebody had a surgery and they can't get in, and they need to be seen within 3 days, that goes on my schedule.
Okay.
As a director, yes, I do get paid more. There is additional time with that as well, but I kind of manage the schedules. I work with marketing, I work with reimbursement, making sure we get paid. I work with our auditing. I make sure that we have all the regulations in place, that we meet all the guidelines for Medicare, so we still get paid from them. They're very kind of restrictive if you don't have those. I also oversee, at Bone and Joint, I oversee our durable medical equipment, or DME, that's your knee braces, your crutches, things like that. I oversee the athletic trainers, so Kim, who's at this school, and then we have Krista at Wausau East and some other schools. And then I also oversee our work comp department, so we have people that work with injured workers, and we help kind of deal with those and deal with providers. So there's lots of hats as a therapy director I get to wear, which I enjoy, because again, it gives me variety. Every clinic is different. I worked before where I saw 40 hours of patients and oversaw 8 clinics. You know, so it's all different, but I've always liked leadership. I've always liked to kind of help solve problems, and I enjoy running a business, so it kind of fills that bucket for me. Perfect. And as I said, physical therapy assistant, that role is out there. It's harder to find jobs as a physical therapy assistant, and it's not something that's so easy to go get your PTA degree and then go on to PT school, because you don't get credit for that PTA degree. So physical therapy assistants, less time frame in terms of schooling. Their pay, like I said, a new grad is right around $70,000 for PT. New grad for a PTA is probably going to be around $40,000 a year.
And that's a 2-year program, correct?
I think it's going to 4. I'm not sure on that. I thought it was going to 4. But yeah, it depends on your setting that you're into. So I would say the average for that starting is probably $18 an hour, so $36,000, and probably tops out closer to that $55,000.
And do you have a lot of assistants at Bone and Joint?
Just one.
Just one.
And most PTAs work in a nursing home setting. It's just, for them, it's cheaper labor. For us to have a PTA, the way we're licensed through Medicare, is we have to have what's called direct supervision. So PT assistants can't just function on their own. They have to be there at our clinic with a therapist. In other settings, they can be supervised via phone or something like that.
Any questions? He did mention, I don't know if you want to talk about if they want to come.
Yeah, I did leave some cards, so if you have any interest and you want to come observe, we always are accepting students to come and do some shadowing. Most PT schools, they require some shadowing before you apply, so it's 100 hours at a lot of them, and they have to go to either a hospital or an outpatient orthopedic setting to get those hours. We do accept students anytime, so if you are considering it for a career, we just have you get in touch with their HR and kind of go from there. But
Great.
all right, thank you all very much.
All right, so we've got a few minutes, just hang tight.